All right, let's jump right in. OpenAI just did something that could completely flip the script on how you think about your health. I mean, forever. So we've got to unpack this.
Okay, be honest. Have you ever Googled a simple headache and 10 minutes later you've diagnosed yourself with some super rare, probably fatal disease? Yeah, we've all been there. It's a classic. Well, that whole late night spiral into anxiety, that thing they call cyberchondria, it might actually be on its way out because OpenAI has just thrown its hat in the ring. So yeah, OpenAI is now officially in the healthcare game, and their goal to take all that chaotic, random searching and replace it with something structured, something actually personalized. And look, this isn't just another health app. This is a potential revolution in the making. Okay, so here's the headline. On January 7th, 2026, OpenAI dropped 2 brand new products. And this is a big deal because it takes their AI from just a general do-anything tool to an official medical support system. Let's break down exactly what they've built. All right, first up, there's the one that's meant for you and me. It's called ChatGPT Health. The best way to think about it, it's like having your own personal AI medical assistant right in your pocket, designed to help you make sense of your own health. And they've designed it to be super, super simple. It's basically 3 steps. 1, you connect your health data. 2, you just ask your question, in normal, everyday language. And 3, you get back a personalized insight. That's it. So you're probably wondering, where does it get this data? Well, it's not just what you type in. This is the cool part. It can pull directly from the wellness apps you might already be using, things like Apple Health or MyFitnessPal. And if you're in the US, it can even connect your official electronic health records. It brings your whole health world together. So what can you actually do with this? Well, imagine this. You could upload your latest lab results, that confusing page of numbers, and just ask, hey, is my liver function looking okay for someone my age? Or maybe you've got a doctor's appointment coming up. You could have it create a list of really smart, specific questions to ask your doctor, all based on your recent symptoms. Pretty powerful stuff. But wait, that's only half the story. The second product they launched, well, it isn't for us. It's for our doctors. It's called OpenAI for Healthcare, and it's basically designed to be a new kind of clinical partner right there in the hospital. And make no mistake, this is a serious professional-grade tool. We're talking about automating all that tedious charting and documentation doctors have to do. It also provides them with clinical support that's actually backed by the latest medical journals. And here's what gives it weight. It was developed with top-notch institutions like Boston Children's Hospital, and it is fully HIPAA compliant. That's the big US standard for protecting patient data. So when you put these 2 things together, one tool for you, the patient, and one for your doctor, you start to see the bigger picture. We're not just talking about an app anymore. We're looking at a potential redefinition of the entire health journey. This really is the big shift. Think about it. We're moving away from the old way, searching for generic articles online that just make you anxious, to a new way, analysis. Real analysis that gives you personalized, context-aware insights that actually empower you as a patient. And the potential upside for everyone is just huge. I mean, if the AI can handle all the busy work, the charting, the data entry, what does that free up doctors to do? To focus on the human stuff, the communication, the empathy, the really complex problem solving. The things we actually need them for. But this also brings up a totally new and fascinating dynamic. Just picture this conversation in an exam room. A patient looks at their doctor and says something like, but the AI said my liver function is a bit off, especially when you factor in my sleep patterns from last week. Are you sure it's nothing? Whoa. Suddenly you have this potential authority conflict, right? An empowered patient armed with AI analysis challenging a doctor. It's a whole new world. Okay, but for any of this amazing future to actually happen, everything, and I mean everything, hinges on one massive, unavoidable question: privacy. Can we really trust a big tech company with our most sensitive personal health data? Should we? Now, OpenAI knows this is the big issue, and they're making 2 core promises to try and build that trust. Promise number 1, your data gets analyzed in what they're calling a completely isolated environment. And promise number 2, and this is the big one, they swear your personal health data will never be used to train their AI models, period. So what exactly is an isolated environment? The easiest way to think of it is like a digital safe room. Your data goes in, the AI does its analysis for you right there, and the answer comes out. But the data itself, it never leaves that room. It's never mixed with anyone else's data, and it's never used for anything else. It's a one-time in-and-out job. But look, even with all those technical safeguards in place, a huge hurdle is still there. And it's not really about logic, is it? It's about a feeling. It's that fundamental gut feeling, that deep unease a lot of us have about our most sensitive health data just living on a big tech platform, no matter how many promises they make. So this is what it all boils down to. On one hand, you have this incredible technology that offers a future of proactive, super personalized health insights that can empower us in ways we've never seen before. But the price of admission to that future is our data. So the final question is for you. Is that a price you're willing to pay?